Hey guys, it's Dr. T. We're going to be dealing with an acute viral or bacterial infection of the lungs. Remember, if you're dealing with comorbidities, this is the time to seek medical help. If you're dealing with a strong, healthy body and you've been using our products for a period of time, I'm giving you 4 days to kill this bad boy, and then seek medical help if you have not finished the job. Number one, always look at your fever levels. A fever is not until 100.4. That is where a medical fever begins. I'm going to allow you 100 to 103. I want the body to pump. I want to kill off this virus. I want to kill off this bacteria, whatever you're dealing with. So it's okay to elevate your temperature as long as you're getting your substances in, your fluids in, your formulas. All right? So we are going to take a thermogram reading of your temperature, and I want you to record it on your tracker. If you are able to, for 3 straight days, keep your temperature at 99 or below, you have defeated this monster. So periodically, at least 5 times a day when you're ill, I want you taking that temperature, recording it, watching those temps. I don't want them going over 103. Next, heart rate. I want that heart rate in the 70s or the 80s. If it's going above that for long periods of time, we've got trouble. The body is failing. It is losing this fight. So keep an eye on the heart rate. I also want you to take that 5 times a day. PO2 levels. Remember, guys, I talked to you about the oximeter. The oximeter is important for this. It's going to give you not only your heart rate, but your PO2 levels. We want to keep those PO2 levels 90 plus. Obviously, 99 would be optimal. That is your oxygenation. That's how your lungs are doing. This is going to tell you, is this virus winning or you winning? You're going to take the PO2 levels at least 5 times a day and record those. So, first thing first, we're going to prepare ourselves to get into bed and get some sleep. That is crucial for this process. We need our bodies building. We need our immune systems going. So how are we going to do it? We're going to take a shower. Very hot shower, 115 to 120. Be careful. The virus can cause vertiginous syndromes. The virus can cause syncopathy. So be careful if you're lightheaded. Make sure somebody knows you're in the bathroom. But I do want you to sequester yourself from your family. Find a bathroom and bedroom setup where you can be the only one in here. Our goal, 4 days. Medical profession, 14 days. We do recommend a 14-day quarantine, but I want you to kill this bad boy in 4. So let me show you how to do it. We're taking a hot shower. After the hot shower, we are going to vigorously clean our hands. I recommend using an active probiotic cleanser. This is for surfaces, so be very careful. I spray a small amount onto the hands. I was brought up Catholic, so I will say the Our Father, who art in heaven, hallowed and holy is your name. And I keep going with that until I am done. Our goal also, this virus is very fragile. We want to really agitate it. Clean under the fingernails. In fact, ladies, I would recommend getting rid of all false nails. I would also clip those fingernails as tight as you can, at least for the next 14 days. And then I really want you scrubbing up the hands. After you've scrubbed up the hands, you are ready to actually begin to treat the body. The first thing that we're going to be treating is we're going to apply colloidal silver. In this case, this is argentin. Argentin is going to go into the eye. 2 or 3 drops. It is also going to go into the ear. This virus can penetrate these orifices, so we want to be ready for it. It also can exude itself through these orifices, and we want to protect our family members. So silver in the eyes, silver in the ears. The next thing that we're going to do is we are going to apply magnesium tetrahydrate onto the chest cage and also onto your glands. Chest cage and glands. Why? This is a respiratory virus. We want to make sure that nothing is impinging or impeding your ability to take deep cleansing breath. So we're going to get it into the upper dorsum. We're going to get it onto the clavicles. We're going to get it into the lymphatics. So the lymphatics are draining back in the back of the neck as well behind the ears. This is going to cause muscle relaxation. This is going to cause the lymphatics to flow. This is going to allow us to take deep cleansing breaths. Very important with this virus. Number 2, onto the chest after the magnesium. we are going to put Tamanu oil. We're going to put that at the apices of the lungs. The apices of the lungs are basically right above the clavicle, right in this region where the clavicle and the lymphatics drain. I want you to be careful when you're rubbing in here, and then I want you to go down into the sternum. The sternum. We're going to continue to rub the Tamanu and the magnesium deep into the chest cage, into the throat, and deep into the sublingual glands, the submandibular glands. This is very important for you to have free-flowing lymphatics in this area. So we finished the Tamanu, we finished the magnesium, we finished off with the colloidal silver. Now you guys know this one that are in metabolic boot camp. This is the piece de resistance. This is what is really protecting our people. This is a combination of coconut oil, our L-glutamine from our metabolic kit, and colloidal silver. We will push this into the sinuses. We will also use this as toothpaste, and we will brush the teeth for 2 full minutes. We will massage this in. After we finish the sinus and the oral application, we are also going to spread this onto the face, into the ears, around the neck, and then back down onto the chest. Really rubbing this in. Why? Couple reasons. We want to kill off all the superficial subcutaneous bacteria and viruses. We also don't want to reinfect ourselves. We also want to protect our family members as we're going through this process. So, finally, what we're going to do is we're going to take our metabolic organic shield. So we use the paste into the sinus. We use the paste into the oral cavity. We are then using the paste onto the skin into this region, but we're going to finish off with our organic paste. Our organic shield. The shield will be sprayed on the face, on the ears, back of the neck, into the chest cage, as well as onto the hands. Some of you actually even enjoy into the throat as well, and I'm fine with that. Guys, we have created a very clean organic shield. We are going to need to do this at least 3 times a day during our 4-day battle. Why? We want ultimate immune function of our skin, our oral cavity, our sinus cavities, and any orifices. Remember, building the walls and also bringing on the watchdogs. The walls are our membranes. The watchdogs are the healthy bacteria, which we just put on our skin, which we just put into the nose. And what this virus is going to do is it's going to run into these guys. They're going to corner it, and they're going to start to contain it for you. That is our goal. One last thing. We also like to create an organic barrier around where we are staying. So spray down the counters, spray down the toilets, spray down the shower, spray down the doors. We are now going to move into the bedroom and get ready to battle this bad boy from the blood side out. Are you ready? Let's go. Hey guys, we made it into the bedroom. One thing that you want to make sure of when you are preparing your area for the healing process, you want to make a bubble, antiviral, antibacterial. Atmospherically, you need to control this area. We want you to turn on an ionizer, preferably that is using a silver filter. This ionizer is going to keep the bacteria and viral counts low in the air. Why do we want to do that? One, not only for you, but people that are in your area. Please do not let people come into your physical realm. You will not be eating foods from their plates. I want you to use disposable cups, disposable plates, and you're going to throw that all out in your own trash area. You're going to dispose of your own trash. Please remember this. This bad boy, this virus, loves to attack the lungs. This will cause you severe dehydration. You may start to cramp. So you must keep your fluids up. Yes, we're going to give you your formulas at a high dose to help you fight this. But we also want you to consume extra water. We want you consuming at least 20 to 30 ounces of extra fluid. So make sure you've got your bottles of water ready, and then throw out those plastics into a trash bin. You're going to take care of that. Do not let others handle your trash. These are areas that are very highly infected with your virus. So what are we going to do to protect our lungs? One, there's a amino acid called NAC. If I could, I would put that into your blends. However, it is a disulfide bond. Disulfide bonds, some people are sulfur sensitive. If you are allergic to antibiotics, you cannot use NAC. If you are not, this is going to be an easy kill, in my opinion. You will be consuming your formulas, but you will also be taking in 3 capsules of NAC 3 times a day. So you'll go to a total of 9 capsules. You will smell a difference in your urine as you're getting rid of the virus. It will have a unique odor. Don't worry, this is a good thing. NAC, 3 capsules 3 times a day for a total of 9 capsules. Guys, get aggressive. You have 4 days to kill this thing off. Your vitamin D, you already know what I think of vitamin D3. It is fantastic as an antiviral at high enough levels. You were at 20,000 for protection. You are now going to go to 50,000. 50,000 IUs for those 4 days. That will be, in this case, if it's 10,000 capsules, you're taking 5 a day. Yes, that can toxify your liver. Yes, that can calcify your arteries. But that's not going to happen within 4 days, and it's not going to happen with the other things that you're taking to protect your liver, such as your AM and PM blends. So please be very aggressive with the D3. Be careful, because we're going to be placing you on antiviral protocols that also thin your blood. So you may find your blood is much thinner. You might bruise easier during these next 4 days, but I want this virus dead within 4 days. Finally, olive leaf extract. Olive leaf extract is the most cited plant in the Holy Bible. The Bible is medicinal. God's Word is fractal. It will penetrate medicinally into our bodies. Olive leaf is absolutely fantastic. You'll be taking 3 capsules 3 times a day, identical to your NAC protocols. So you're working on this for the next 4 days. Now, here we go. We're going to go into the big fighters, your warriors. First one is your viral vanquisher. What is that? You're going to drink that in the morning. That is your AM blend, 1 scoop. That is your vanilla. That is your cinnamon, 1 teaspoon. That is ice, water, and 1 teaspoon of glutamine. Blend it up, drink it down. It'll help you tremendously with your sore throat. It has an antiviral effect. It is tremendous with regards to ramping up your immune system and boosting it. Next up, you can have a cup of your Combat coffee if you're a coffee drinker. If you are not, take 2 scoops of our coffee collagen, put it in hot water, blend it up. You can put it on ice if you want, and that will make a nice hot cocoa. This is important. We are finding the type of collagen that we're using is creating white blood cells that are vigorous and strong. They have the death grip on them. They have such strength to them. They get a hold of that virus, they're not letting go. That's exactly what you want them to do. So let's kick that collagen up. But remember, our collagen also has the bacteria in it. This is a very strong bacteria that is going to ramp up your immune system, found within the middle of your body, called GALT. It's a tissue called GALT. You want that as powerful as possible. That bacteria is going to help you fight this virus. Next up, you are going to drink your big pink drink. You guys know what that is. That is your AM blend. You can have 1 to 2 scoops of that and 32 ounces of water. But I also want more water. Drink as much water as you can. Remember, we want that virus being cooked by your fever. The fever is going to dehydrate you. It's going to kill the virus. But if you don't hydrate yourself, the fever can kill you. So do not allow your body to get dehydrated. How do you know if you're dehydrated? In the bathroom, your urine looks like it is brown. You're producing very little urine. That is a very bad sign of dehydration. This is where you need to communicate immediately with your medical profession. But if you're keeping your fluids up, you're going to make it through this. So drink at least 2 additional bottles of water above what we're recommending. Next up, at noontime, you're going to take PM blend in hot water with 2 scoops of Pro Collagen. I know you guys are used to taking the PM blend to relax. Absolutely, that's used at night, and that's something you can do on a regular basis. But when you're fighting this bad boy, the PM blend has 3 antivirals in it. It also helps you with body pain and body ache. We're going to use it at noon, and then we're going to finish off with an additional dose at nighttime. I want you to eat only one meal a day. That is in the middle of your day around 1 to 2 o'clock. I do not want you eating after that. Viruses love blood sugar. Viruses hate intermittent fasting. They start to starve off. They really have problems when we're fasting. So focus on one large meal. The rest of it is fluids, fluids, fluids with these hypernutrients. If you find that you cannot sleep because you're coughing, elevate yourself to about 45 degrees, Tamanu on the chest, magnesium on the chest. You can even rub the Nature Shield into your feet. If you are not sensitive to acetaminophen, if you are not sensitive to warfarin, you can use Mucinex Night Shift at any time you would like. We would rather you not use it because the acetaminophen is going to lower your fever. Remember, we want that fever cooking as long as you're remaining hydrated. Guys, you've got 4 days to kill this bug, smash it, and get on with your life. Love you guys, praying for you. Let's go.